Okay. Hi, everyone. Hello. 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 I'm sorry I'm coming late. I've been struggling with my devices. Oh dear. Hello. 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 Okay. So I'll be starting shortly. Let me wait for people to come on. Hi. So I'm actually having to use two devices because I don't know. I'm unable to. Okay, 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 okay. Hi everyone. We're about to start. Sorry I'm coming late. I've been fighting and struggling with my devices. Hello, hello, hello. So quickly, I'll just start off to save us time. Okay. So I'll just start shortly. Just give me a minute. Let me get my slides out. Hi, Pastor Ovi. I finally got it out. I had to get lessons from my big sister when I was struggling to get online. Oh dear. Okay, 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 okay. Slide. Okay, 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 okay. Slide. I'm just trying to get my slides out so I could share my slides and go on. So how are we all doing today? Oh my God. Okay, now view. Okay, am I going to how do I get people can't hear me. Hello, can you hear me? Hello? Oh dear. Okay, now I have to get so can you hear me now? Can you hear me now? Okay, yes, okay, I'm being heard now. Okay, so let me start quickly. Nice to have all of you here today. I have to get this. Am I still being heard? Okay, good. So I'll start a screen share. So quickly, the subject we're discussing today is actually kind of a personal one to me because I have been affected by breast cancer as um, I've witnessed it happen to my mom. I've recently just lost an aunt to breast cancer this month, and I've lost friends to breast cancer, painfully so. Young friends. When I was in my 20s, I lost a very dear friend to breast cancer. And um, just a small, I'm now struggling to share my screen. No, 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 no. No, 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 no. Okay, now I'm struggling to share my screen. Okay, okay, okay. I think I've gotten it now. Let me see. No. Okay. Okay. I don't know if my screen is being seen. Are you seeing my screen? Hi. If you can see my screen, can you let me know? Because I think I'm still struggling with the. Can you see my screen? Okay, my screen is being seen. Yes. Okay, good. So I'll just quickly. I'll just quickly do this. Start. It's oh dear, oh dear, oh dear, oh dear, oh dear. Okay. So today we'll just be talking on breast cancer. I'll take questions afterwards. And I'm not very conversant with the app I'm using to broadcast on multiple streams now, so please pardon me. Like I said, this is a subject that's quite very personal to me. I've actually experienced breast cancer when it affected my mother. I lost a dear aunt who used to be my guardian when I was in university to breast cancer this month. And I've lost friends. I've seen it affect people close to me. I've seen hundreds of multiple numbers of patients suffer from breast cancer. But one thing I want you to know is that early detection is one of the most prognostic factors, the best prognostic factor for breast cancer. So I'll just go through this. Our discussions today, we'll be talking about what breast cancer is, what is breast cancer. Sorry for those on Instagram, it's a shame that I'm unable to broadcast on Instagram from the app I'm using, so I'm not able to share my screen on Instagram. But I'm going to post this video on Instagram afterwards. So we're going to talking about what's breast cancer, who gets breast cancer, how common is breast cancer, breast anatomy, what causes breast cancer, risk factors for breast cancer, hereditary factors for it, prevention, which is what we all hear about today. How can you prevent or reduce your risk for breast cancer? We just lightly talk about treatments because we don't really want you to get there, and self-examinations. So what's breast cancer? First and foremost, it's a cancer. We all know what cancers are. Cancers are when the body produces abnormal cells that grow out of proportion and causes disease. So it happens that breast cancer is second only to lung cancer as a cause of cancer deaths in women globally. And it's so predominant that 1 out of every 8 women will be diagnosed with breast cancer in a lifetime. This was when this study was done in 2011. That's when the estimates came out for this. And thankfully, radical mastectomy, which is like the total removal of the breast, is rarely needed today because we have a lot of there's been a lot of treatments for breast cancer that would actually assist a woman before it gets to that stage. So like we said, I said earlier on, when breast cancer actually starts, when cells in the breast begin to grow out of control, these cells form a tumor, and this can be seen on radiograph like mammogram, x-ray of the breast, or through ultrasounds. And these tumors can be cancerous if the cell grows into out of proportion and into surrounding tissues, spreads to distant areas of the body. And it's also important for us to know that men also can get breast cancer. Yes, 2% of breast cancers happen in men. And the breast cancer can start from different parts of the breast. It can start from the ducts that carry milk. It can start from the skin area. It starts from everywhere, even the fat tissue, fibrous tissue. It starts from every part of the breast. Not every woman that has a lump in her breast has breast cancer. And not every woman that has a lump will develop breast cancer, so that we're clear on that. So who gets breast cancer? First and foremost, it's a majorly a woman disease, even though it happens rarely in men. And the incidence of breast cancer amongst Black women is lower than that for white women. But however, more Black women die from breast cancer than white women because of one reason: late detection. Every 2 minutes, one case of breast cancer is diagnosed in women globally. And currently in the world, there are about 3 million breast cancer survivors. And so that we'll know, half of the global burden of deaths of the disease happen in low to medium income countries like ours in Nigeria. So let's talk about the breast anatomy. How's the breast? The breast is made up of adipose tissue, fat tissue, with connective tissue interlaced within it. So it's like an orange. I like describing it like an orange that has not the fibers of the orange. Those are like the fibrous tissue, the pulp and all that. The juicy parts of it now becomes the adipose tissue fat. So the breast has lobes, it has ducts, it has lymph nodes that drain fluids from all around the breast area. It also has blood vessels as well, because blood is supplied to the breast. The breast has no muscle. There's no muscle in the breast. The only muscles are under the breast and separates the breast from the ribs. So what causes breast cancer? There is no known cause. There's not one known cause like, okay, this is what causes breast cancer. However, there are a lot of risk factors, and the most likely cause is related to changes in the DNA of the cells. So a normal cell is assaulted by some assault in the body, and changes the DNA material of the cell gets reconfigured and starts growing abnormally. And these cells divide more rapidly than healthy cells do. And from there, it forms into a cancer. So what are these factors that determine the risk of developing breast cancer for women? Well, I'll first of all talk about the unalterable factors, which are like the ones you cannot change. One, you are a woman. So if you're a woman, all women are at risk for breast cancer. A woman that is attaining the fourth, fifth decades, as the woman gets older in age, she is at more risk of developing breast cancer. A woman that has a family history or personal history means that has had a cancer before, is at more risk of having breast cancer. So these are unalterable. You cannot change your family. You cannot change yourself from getting older. even if you do change your sex to become a man, but genetically you're still configured as a woman, so you're still at risk for breast cancer. Then race, like I said, is more predominantly in Caucasians than blacks. Radiation, someone that's actually has had other forms of cancers and has had to, or for other reasons, has had to have radiation therapy, is at risk of cancer. Genetic factors, menstrual history, because this is actually women that start seeing the menses early in life, before the age of 12, and stop seeing their menses later on in life, so they are more exposed to estrogen in their lifetime. Reproductive history is something that we cannot modify, so the woman that actually has had children or has not had children, those things actually predispose someone to breast cancer. But then there are some risk factors that we can control. One of them is obesity. Obesity is very controllable. It's been found that the people that are, especially women that add weight, in postmenopausal weight gain is actually highly linked to breast cancer. So after a woman finishes having kids, she's undergoing menopause, and she starts adding weight. Sometimes it happens, it's very common amongst African women. In the later ages, they start adding weight. And that is more like they're predisposing themselves to developing breast cancer. Exercise is like as a no-brainer for every type of disease prevention. Exercise is very paramount. It's effective. It reduces the risk for cardiovascular diseases, for cancers, all forms of cancers. Because one thing is, this exercise actually optimizes your blood flow in your body. So a lot of your organs in your body receive adequate blood perfusion and function better. It also releases endorphins in the body and some other hormones that actually have the potential of prepping the body to be able to fight cancer cells or fight toxic cells better. Breastfeeding is protective for women against breast cancer. Alcohol is actually, it's predisposes the woman to having breast cancer, and as we go along, we'll talk about it. Hormone replacement therapy, people that actually are on hormonal replacement. I want to talk about this a bit because I remember I've actually had to caution a lot of people close to me in Nigeria because of the poor control of pharmaceutical drugs in Nigeria. Women they go on their own to purchase hormones. So I remember a lady that told me she was taking estrogen tablets because of her skin, that it was helping her skin look better. Even women put themselves on fertility medication by themselves in a bid to get multiple pregnancies. These are risks. And birth control pills, people that actually have genetic risk for breast cancers are not advised to be on birth control pills that have estrogen, or rather not at all. You should find other alternative methods of contraception. Then the risk of not having kids, pregnancy and having children actually reduces the risk of breast cancer. So if the woman can actually have kids, it reduces her risk of having breast cancer. Now, hereditary breast cancer. So hereditary breast cancer is when someone inherits the genes for breast cancer. It happens in like 5 to 15% of, more like 10% of the cases. So it should be suspected when several close family members have been diagnosed with breast cancer or with ovarian cancer, because breast cancer and ovarian cancer, they carry the same risk. The genes, the genetic BARCC gene. So the thing about this is this. I remember one time I had a patient who her mother had passed through me for treatment for breast cancer. Her mother's sister, her aunt, passed through me for breast cancer. And then it happened to her own eldest sister. And I talked to her. I told her, look, I think you should have your DNA checked for the gene, for the breast cancer gene, because you've had 3 people close to you, not just relatives, but people really close to you in your close family tree that have been diagnosed with breast cancer. And she didn't anyway. She said no. She had opportunities too, because she was actually exposed. She could travel, and it was so sad that one day she calls me and tells me, "Oh, doctor, I need to talk to you about something. I need to see you. I need to see you. What's it?" And she explains to me that she discovered a lump in the breast, and thankfully it was quite very early. So at the moment she came, we looked at her breast. She had a lump. She did a mammogram. It was confirmed to be a lump. That it didn't look good after on biopsy. It didn't look good. She got rid of it. She actually got rid of everything. Her breast. She did a double mastectomy. She did the Angelina Jolie style. I'll say that, because that period was when Angelina Jolie cut off her breast for her own high risk. She took out everything and said she didn't want any exposure to estrogen in her body to predispose her to having breast cancer because of her history. So if both breasts, if a woman has breast cancer in both breasts, it's very highly that it's a type of cancer is hereditary. So I want to talk about more like break down these risk factors into what people would understand better. So we talked about age. Age is over 50. Women over 50 are more predisposed to breast cancer, but we've seen women of as young as 18, 19 come up with breast cancer, but most of the times it happens with women over 50. So personal or family history, like I said, which most times the first degree relative, a mother, a sister, an aunt. Then people with high breast tissue density, because of the breast is dense, a lot of fibrous tissue, they tend to come up with a lot of lumps, and after most times still fibroadenocarcinoma. So people that have actually had high dose radiation to their chest during medical procedures, women that had their first pregnancy after the age of 30, women who have no children, women who attained menarche before the age of 12, meaning that they actually started menstruating before they reached the age of 12. And I want to put this like a note on that one of the biggest cause of this, because I've actually seen in my practice, I've seen a lot of children nowadays, 8 years old, starting their periods. It's not right. It's all diet based and obesity, because that's not how the body was formed. I think scientifically, and a girl should start seeing a period around the age of 12. So when the girl starts around 7, 8, it's totally early menarche. And most times it's caused because of diet, wrong diet, and childhood obesity. So let's be watchful. If you have young kids, be watchful with what they eat. Try and encourage them to exercise, and so that you reduce their risk of having not just only breast cancer, but other even cardiovascular diseases and diabetes. Also, it has been linked with this as well. So women that attain menopause after the age of 50, because then they're still exposed to estrogen for longer than they ought to. Then, like I said, postmenopausal obesity, women that start adding weight after they've attained menopause. Alcohol consumption, studies have shown that women that actually drink more than 3 glasses of wine a day, do you drink? No, I'm not. I don't drink, but I just take 3 glasses of wine or half a bottle of wine a day. That's not good. It actually predisposes a woman to increases a woman's risk to breast cancer. Personal history of breast cancer, like I said before, former breast cancer, ovarian cancer, or endometrial cancer actually would predispose a woman to breast cancer. Then the Jews, people that are from the Ashkenazi Jewish heritage, they are actually predisposed to a lot of many cancers. Women that have had oophorectomy, that we remove their eggs. Then People with BRCA2 1 and 2 mutations, those are like the the genes for breast cancer. And smoking, not just smoking, like functional smokers, but even secondary smokers, people that stay where people smoke, they're actually predisposed to breast cancer. And I will add this because where I'm from in Delta, we eat a lot of smoked fish. Women that consume a high quantity of smoked food also are predisposed to, because taking a lot of toxins, it's just like, okay, you've taken a lot of toxins, that's what it means. So that actually predisposes a woman to breast cancer. How do you prevent breast cancer? First of all, you modify risk factors. This is the easiest step. It's easy peasy, but it's the most difficult thing for people to do because of lack of self-control. Modify risk factors. It's cheap, costs you nothing, even saves you money. Then detect changes in your breast early. Also, there are some other pharmacoprevention that actually have been advised by doctors for women at risk. So what factors can help you lower the risk of breast cancer? Like we said, healthy weight gain. Healthy weight, maintaining a healthy weight, reducing weight if you're obese. That's reducing your BMI, your body mass index. You stop smoking. Smoking is totally a no-no for cancers and many other diseases. In fact, every disease right now has been linked to smoking as a risk factor. Even diabetes, cardiovascular diseases, cancers, name it. Most of the diseases now, they've been linked to smoking. You have to start some physical activity. We live a very sedentary lifestyle, especially those people that live in Lagos. You wake up in the morning, you get into your car from your garage, you drive to work, you climb into the office, or you spend your time, the only thing you work more than working on your computer or having meetings is in traffic. So try and incorporate some physical activities into your daily regimen, and no alcohol use, or if at all, very minimal alcohol consumption. So we'll start from diet and weight loss. First and foremost, let us get this clear. We are what we eat. Garbage in, garbage out. You don't expect to take in toxins and not have disease come out from your body, because you are what you eat. Most time I see people buying all kinds of products for their skin and all that. I'm just wondering, because if you're not eating well, you're eating very poor meals, and you're not taking supplements to even help you, but you're using all your money to buy something for your skin. Most times I'm sure, like many doctors, we just look and wonder how this miracle would work, because we are what we eat. It shows from within us, from within outwardly. So it is recommended that we eat food rich in fiber, because of one reason. Fiber would improve your bowel motion, and it will not allow toxins to build up in your body. So when you eat, you easily digest your food, and you take out the waste from your body, so toxins are not left in your body for longer than they should. You take in food with antioxidants. Antioxidants oxidate toxins. You're taking meals high in vitamin C. Vitamin C is sorry, I just want to take something. Just 1 minute. Let me get something. Okay. So vitamin C actually is known to be antioxidative. So you've taken things like watermelon, oranges, even the vitamin C supplement itself. Even during this period of the pandemic, we all saw how valuable vitamin C became to us. Lemons, calcium. There's been studies that have been done, and calcium has been found to reduce the risk of breast cancer significantly, very significantly. We'll get there. Lycopene and liminoids, they are in foods that have them as well. These are substances in some food that prevent tumor formations, and like fruits like grapes have a lot of them. There's a study that was done, the Emory study amongst nurses. It showed that there is an inverse association between serum calcium and breast cancer risk. So women that are taking high calcium, they had a 90% reduction in breast cancer, as opposed to the women that had low levels of calcium. Like I said, smoked food. It's advisable for women to reduce smoked food because high consumption of smoked food increases the risk to breast cancer. Exercise improves blood flow in your body. It optimizes your body's hormones. It helps reduces stress. It helps improve sleep. And these two things have been linked to breast cancer incidence, because stress actually would the stress hormone glucagon is not helpful. It reduces the suppresses the hormones that fight against cancers and toxic substances in your body. And also sleep deprivation has been linked to breast cancer as well. So physical activity has been seen to decrease breast cancer risk by lowering ovarian hormone levels. Women who reported to have had 7 hours of physical activity weekly had an 18% lower risk of developing breast cancer. So that translates to like 7 hours translates to like 1 hour every day, or 1.5 hours every day a week, every other day for a week of exercise. Secondly, eliminate toxins. Consuming as little as 3 glasses of wine every day was found to have increased a woman's chances of contracting this disease. And the research showed that the risk was increasing with the increase in alcohol consumption. So the best predictor for how much alcohol would play a part in a woman's risk for breast cancer involves calculating alcohol consumption across a lifespan. So some young ladies will say, oh, no, it's okay to party. Okay, I'm going to drink today because I'm young. I'm not predisposed to breast cancer. And when I'm like 40, 50, I'll reduce it because that's when breast cancer affects women mostly. Sorry, dear, that's not how it works. The risk actually starts from how you've been drinking since you started drinking. So alcohol consumption, the risk is calculated based on the alcohol consumed for an entire lifetime of a woman. Tobacco use has been implicated as the key predisposing factors for multiple diseases, and breast cancer is not exempt. Tobacco smoking releases toxins into the body that are carcinogenic, they're cancer causing. So, like I said, not just only people that principally smoke, but people that actually are secondary smokers, people that stay where people are smoking. Hormone use and contraceptives. In 2002, it was discovered that hormonal replacement therapy increased the risk of breast cancer, stroke, and heart attack. In Canada, the risk of hormonal replacement therapy, the use of HRT declined the risk of cancer by 8% in 2 years. So 8% of women who stopped using hormonal replacement therapy did not develop breast cancer as against the years past. So it's been advised by the American Medical Association that women that have a clear history of breast cancer should not be on hormonal replacement therapy, should not take oral contraceptive pills. They should find other methods of birth control and not hormonal. Stress and sleep. This is a very key one because most times we just flog ourselves as long as we think we can. We are strong. We're made to believe we can do without sleep. We can take on as much stress as possible and we won't break. It's good to be strong, but sincerely, our mental health we should make sure we pay attention to our mental health because it's a part of our overall health and it affects how our body would fight cancers. So sleep plays a role in reducing cancer development, and studies were done by Dr. David Spelberg and another Dr. Septin of Stanford University, and they found out that the amount of sleep you get affects the activities of cortisol in your body, and cortisol is the stress hormone of your body, and it actually reduces the release of natural killer cells of your body. So most times stress would increase, with increased stress, your body produces cortisol, and also with low sleep, your body produces cortisol, because low sleep, it means it's actually with stressful, the stressful situation. And for us to know this, the hormone melatonin that actually your body produces for sleep actually is protective against breast cancer, because it's the way it reacts with, it interacts with estrogen receptors of your body and reduces the occurrence of breast cancer. It assists. So breast cancer has been found to be prevalent in women that work night shifts because of their poor, the disruption, they've disrupted their body's circadian rhythm. And people also that have obstructive sleep apnea, they've been found also to have an increased cancer risk across all cancers, not just breast cancer. So how do we check our breast? I'm going to play a short video, but before I do that, I want to let you know, first of all, you do an inspection. You inspect your breast. You look at your breast, the skin of your breast for skin changes. Is it normal? How's it looking like? In breast cancer, most times the skin looks like the orange peel skin. They call it the peel de orange. It looks like orange peel. Is it red? What's the color of your breast? Is there any part of the breast tissue, that your breast skin, that is different from the normal breast skin? Is there any visible bump? Is the nipple crusting? Is there symmetry between your breasts? Is one of them going north and the other going south? Then you raise your hands up. When you raise your hands up, you expect your breast to raise evenly with your hand raised. And when you raise your hands up, you should watch for dippling or retraction. So I'm going to play this video now. I don't know, for those of you that cannot see it, it's a short video. Like I said, I'm going to share the live stream on Instagram, for those of us that are on Instagram live now. Starting with a visual examination of your breast with your arms by your side in a neutral position in front of a mirror. Look for any of the following: changes in the shape and size of one breast, dimpling or puckering of the breast skin or nipple, persistent rash or change in the skin around the nipple, nipple inversion, retraction, bleeding or unusual discharge. Meanwhile, people on Instagram, I promise to share 10 units of breast light. So if you have a familiar history, more like you have a family history of breast cancer, inbox me, send me a DM me your phone number, your name and phone number for the free 10 units. So to choose our winners, your age, your name and phone number, and the person in your family that has been diagnosed with breast cancer. To feel for changes in your breast, underarm, and collarbone areas more accurately, do so by lying down, because the breast tissue spreads out evenly across your body. This makes it easier to feel for lumps. What you should look out for: a lump, swelling, or thickening in the breast or underarm area. Any enlarged lymph nodes at the underarm and above the collarbones. Lying down. How to examine your breasts when lying down. Elevate your right shoulder by placing a folded towel or pillow underneath. Extend your right elbow outwards and place your right hand under your head. Use the pads of your 3 middle fingers and apply pressure to feel your breast tissue in a circular motion. Use 3 varying pressure levels: light, medium, and firm, to feel for all the breast tissue from on to the next area. All right, so Okay, so welcome back. So we'll go back and complete our presentation. So that's a short video to show you how you can check your breasts. Your self-breast examination is very important. You do it monthly. Though in some part of the world where women have regular health care, they check and they do their checks yearly. They actually would not tell you this, but in Africa, where we only fall sick to get to the hospital, I'll advise you to check your breast. The same week you start your period, check your breast and be sure you check it regularly the way you've watched it in the video, not to miss any of uh, of the changes or any change in your breast. So there are some changes in your breast that you need to, when you check your breast, that if you notice, you must check your doctor. You must visit your doctor's office. If you see a lump, or if you have had a lump before and they've checked that lump and said the lump was okay, and you see a new lump, you should get it checked. If you see any change in the size of your breast, if you see any change in the shape or the color of your breast, you should have it checked. If you see any change in the appearance of the nipple is supposed to be out of your breast. If the nipple retracts, or if it was outside and it's out, like any change in your nipple, you should see your doctor. If there is any blood discharge or any discharge at all, if you are not breastfeeding, your breast is not supposed to be lactating. So not even if you've had children before, like I had a lady that told me that, oh, she thought it was because it just happened because she's had children before. No, if you're not pregnant or breastfeeding, your breast is not supposed to be having discharge. No milk, nothing's supposed to be coming out of your breast. If you see anything like that, please hurry and go book an appointment to see your doctor. If you have any dimpling of your skin, like a dimple on the skin of your breast, you should see your doctor. Or the skin of your breast looks like an orange peel, you should not waste time. Consult your doctor urgently. So what are the treatments for breast cancer? We've talked about prevention, we've talked about risk factors, lifestyle modification, and okay, if there's breast cancer, what treatment options are available? There's surgery, there's chemotherapy, there's radiation, and there's hormonal treatment. So that we know early detection is one of the best and treatment, as in the best cure for cancer, detecting it early. So for instance, there's a lump in the breast. Like I said, not all lumps are cancerous, but if the lump is big enough to be removed, it can be removed surgically, even if it's not cancerous, just so that, especially in women that have high risk for cancers, like they've had family history of breast cancer in their family, it's advisable that they have it removed so it does not change. So for surgery, there's the type called lumpectomy. It's removing the area of concern. The area of concern can be a lump that is there are different grades of lump, even the ones that are not cancerous. There are some of them that actually they are not well differentiated. So they call them the BIRADS type 2, BIRADS type 3. So those ones are not very well differentiated. So if that's a lump, someone finds a lump like that, it's advisable that it be removed by a lumpectomy. That's a small surgery. It's a day procedure just to remove the area of concern and the normal tissue surrounding the area of concern. Then also there's another kind of surgery that can be done in extreme cases when the woman presents late, or this woman has a very high family history of breast cancer, or has been tested and found to have the BROC, the breast cancer causing gene. So then the breast will be removed. It's called a mastectomy. And if the breasts are removed, there are replacements for it. There are surgical replacements for breasts, as in the plastic surgeons can come in and help the woman feel better afterwards and give her and reconstruct her breast post removal. So most women with breast cancer will not have their breast removed because there are other parts, there are other ways that it can be treated with chemotherapy and some other. Now they have nanotherapy. They have some very fine kind of radiation treatment, radiotherapy treatment for breast cancer. And the surgeons, if it's a cancer and the cancer has spread to the lymph nodes will be removed. And so that you know, there are some other cases where breast cancer would not even show in the breast, but the very first sign the person would know or notice is the lump in the axilla, in the armpit. So in that case, those lymph nodes will be removed as well. And that treatment is chemotherapy. Chemotherapy is using strong chemical drugs like I would like describing in a layman's tone. I want to try to make you understand it. Is using medication, but strong medication to kill cancer cells. But the thing about it is that this treatment would kill both the good and the bad cells. So in the process of killing cancer cells, it comes with a lot of side effects because it's the hair loss, nausea and vomiting, fingernail, toenail weakness, there's muscle pain, mouth ulcers, throat ulcers, sleep disorders, and there's also low white blood cell counts, which would predispose the person to infections. So hormonal free therapy is the type of therapy where some women, because of the kind of breast cancer they have, the cancers can be blocked by using hormonal therapy for them. And they take this drug, most times it's tamoxifen. They take the drug for tamoxifen, they take tamoxifen for 5 years, and it actually blocks the hormone receptors of the estrogen hormone receptors in the breast tissue. So the final one is radiotherapy. This is a kind of treatment that uses radiation in many forms. Now there's lots of sophisticated treatments in radiotherapy for breast cancer, brachytherapy. There's so many of them, and thank God they are available now in Nigeria. So the goal of radiation is to kill any cancer cell that might be left around the breast tissue after surgery, because it's an adjunct therapy. So more like you don't just do only radiotherapy most times. They do it to shrink the cancer, to kill the cancer cells around the breast after surgery. Or still, there's another type of one they do that the nanoparticles they put in. They also radio therapy as well. They reduce radioactive materials that kill the cancer cells around the area they are put into. So there's an at-risk woman. Are you an at-risk woman? Because I myself, I know I'm an at-risk woman, being a woman that has I had a mother that had gone through this ordeal with breast cancer. So I know that you have to be more vigilant than every other person. After the age of 40, you should have your mammogram done every year if you're an at-risk woman. Regularly, you should have your breast examination done by a medical doctor, a specialized doctor to check your breast once a year. So sometimes some people would want to go the Angelina Jolie route. They would want to take out their breast if they find out that they have the gene for breast cancer. But I would still advise you that being at risk is not does not mean you're going to have breast cancer. So there are many ways that if you're at risk, you can prevent yourself from having or developing breast cancer by exercising regularly, doing your yearly breast cancer screening, mammogram, because your self-breast examination does not cancel or does not equate your mammogram. Mammography is very important for you if you are if you're an at-risk woman after the age of 40. Yearly mammogram, and your diet. Watch what you eat appropriately. Ensure that you're not just taking garbages in. Junk food is a no. You do not know what's inside. You don't even need all those calories. You need to eat healthy, green. Like I said, things rich in antioxidant, vitamin C, calcium, lycopene. You have to, like tomatoes, you have to eat healthy. You have to be conscious about your lifestyle. You have to ensure that you do not smoke or you don't stay around people that smoke, because secondary smokers are also suffering the same kind of risk as primary smokers. Moderate, if I say moderate your alcohol intake, you may not understand it. Just so that you know, do not take more than 2 glasses of wine a day, because women that have been found to take 3 glasses or more have been seen to increase their risk for breast cancer. Exercise regularly, very importantly. You should do exercises every day. Try as much as possible to ensure that you do at least 10,000 steps. That's what doctors recommend for you a day. Try as much as possible to do your 10,000 steps. Skip if you would, run on the spot if you would, if there's nowhere for you to go to, but you must ensure that you put in 10,000 steps at least, because that does not even equate to the 1 hour of exercise for 7 days a week that has been found by studies to reduce the breast cancer risk. Please do not take oral contraceptive pills if you are a woman at risk. Do not take hormonal replacement therapy if you're a woman at risk. Find other alternatives to birth control. Find other alternatives, discuss them, because if you actually go to a doctor, the doctor will not give you OCPs if she knows that, or he knows that you're at risk. It's only when you go to the chemist to buy those drugs that you buy them, and without understanding that you're causing yourself harm. So if you have a family history of breast cancer, it is very important that before you take in any drug, you should ensure, especially hormonal drug, you should talk to your doctor about it. So now we'll be open to questions. Any questions? So we could answer in, and so that you know, I'm giving out 10 breast light kits. Breast light is a device used to check the breast, an informed, enlightened breast cancer screening tool. Instead of you looking and touching, you could just put the light in a dark place, in a dark room, and it illuminates your breast tissue, and you're able to see if there's a mass in there, if there's a lump. It's so visible as a dark spot in the breast tissue. So DM me, send me a message if you are a woman at risk, so that we could put you in for an opportunity to win one of the free breast light devices today. Well, thank you. Let me look out for questions. So if there are no questions, I will just go through some common questions that people actually ask about breast cancer. So I'll go through some common questions that people ask about breast cancer. Are there questions? I'm not seeing questions. Questions. Please bring in your questions. So I want to just answer some questions people ask. There are some questions that they are common. Any question? I'm not seeing any question here. Ask your questions, please. Let's have your questions. Okay, so let me get to common questions. Some people ask questions like, do tight bras, wearing a tight bra, does it cause breast cancer? Well, first and foremost, why would you wear something that's not comfortable? Like I said, that the breast has a lot of fat tissue, and there are ducts, there are lymph nodes, and there's blood supply to the breast. So, and you're not supposed to constrain blood flow or flow of fluids around any part of your body. Wear a fitting bra, but not tight. A fitting bra it fits well, holds your breast firmly without being tight. So, some people ask that breastfeeding, does it cause breast cancer? No, breastfeeding is actually found to be protective for breast cancer. Women that are found to breastfeed reduces their risk to breast cancer. It's when a woman does not breastfeed that she is more at risk to developing breast cancer. So keep your questions coming. Questions. Let me check if there are questions here. Questions. Keep them coming. We need your questions. Questions. Send me DM for your questions. Okay. All right, so I'll just do some other 2 questions more, then we'll call it a day. So, okay. So there's a question here. Let me get the question. Okay. Questions. Okay. Okay. Someone asked that is lump. How can a breast lump become breast cancer? Okay, because not every lump, most lumps are not breast cancers, like I said, but some lumps would have the propensity of becoming breast cancers because maybe the woman with breast cancer risk, lots of breast cancer risk, and also especially the woman that has genetic predisposition to breast cancers. So in such women, we don't advise them to keep the lumps. They should get them out. So, okay. Questions. Okay. Someone asking that if um, um, breast augmentation would cause breast cancer. No, it's not been found to increase the risk for breast cancer. It's not at all. But however, it all depends on the kind of material. So if you go to a specialist, a qualified specialist, and they don't put in toxic materials into your breast, you are safe. However, if you go to some quack and they put in toxic material into your breast, it's a toxin. So your body will react to toxin by producing cancer cells. So just so that you know, breast cancer and breast augmentation. Okay, I'm not seeing any other question, so I'll also be online checking and updating questions as we go through the week until the end of the month and beyond. If you have an issue you need to discuss or you need to talk to a doctor about, you could talk to me and I could give you a referral. So let's call it a day. Thank you for coming online with me today. And we pray that this information becomes useful to you, guides you, and helps to promote your health and wellness and prevents you from having breast cancer. Take care and goodbye. Bye.